North Carolina's top health official facing strong criticism from lawmakers on the state's slow rollout of vaccines, saying the state is making it up as they go.
Tonight, we're getting answers from Dr. Mandy Cohen on how prepared the state really is. Our Capitol reporter, Michael Hyland, spoke one-on-one with her today. And Michael, she says the limited supply is largely what's driving all these issues.
Right, and if you look here, you can see that 88% of the first doses that have actually come to North Carolina have actually gone to people, a big improvement over a few weeks ago. But some communities are not getting as many doses as they expected, leading to some frustrations with the inconsistency. About 19,000 COVID-19 vaccine doses will go to people at Bank of America Stadium in Charlotte this weekend, the largest event of its kind in the state. Meanwhile, in Durham County, health officials say they aren't booking any more appointments likely until the end of next month because they're getting so few doses. I talked with Health and Human Services Secretary Dr. Mandy Cohen about this Friday. At this point, is the state picking winners and losers when it comes to what regions get easier access to the vaccine than others?
We just have very little vaccine across our state. We wanted to get geographic distribution, but then we also needed speed, we need equity, and we need partnership.
Dr. Cohen says the state is getting about 145,000 doses of vaccine each week. Of that, 90,000 goes to counties based on population. The remainder goes to places with a higher proportion of people 65 and older and marginalized communities, as well as larger scale community events.
We got requests for more than 45 events in addition to the baseline allocations, and we were only able to allocate to about 20 of those.
Cone Health had to reschedule more than 10,000 appointments when they suddenly had their expected allocation cut. That prompted Republican Senate Leader Phil Berger to say this about how the state is managing this.
It's just an indication that they're making it up as they go along.
Is that a fair assessment, or is there a clear plan at this point?
What I would say is, like in any crisis, you have to learn and adjust. We saw that we were slow out of the gate, and we sped right up, and I think the numbers very much show that we are learning and improving as we go.
Republicans in the General Assembly want to hold another oversight hearing on this and have pushed the state to use more primary care physicians and pharmacies to administer shots to people. Why aren't we utilizing more of those resources?
We have such a low supply. I can barely get enough vaccine to the providers we have now in all of the access points we have now.
I've been waiting for that moment.
You can see here last week the state administered about 100,000 more shots than they did just the week prior. Dr. Cohen says now that the backlog is clearing, that's going to be leveling off because we're going to get a consistent amount of doses for the next few weeks. She says the state has the capacity to administer about 3 times as many doses as we're getting, but we're just not getting the supply to do that. Live in Raleigh, Michael Hyland, CBS 17 News.